Many people commonly ask me when they've been diagnosed with a hernia is there a non-surgical option or a medical option where I can take some medications and this hernia can be cured? Now, hernia treatment is only surgery. Unfortunately, that's the only option that you have if you've already got a hernia. Why is it only surgery? This is something which I wanted to explain here. Now, basically, what is a hernia? We've seen before, hernia is basically a defect or a weakness through which your intestine comes through this. Now, are there medications to close this defect? Unfortunately, today, even in the modern medicine in the world, we don't have medicines to close holes that are there inside your abdomen or anywhere in the body for that matter. The only treatment is going to be push back the intestines that are herniating through the hole or the defect, and then closing this hole and putting a nice reinforced mesh, which is basically a prosthetic material which we place, and placing it there so that in future you don't develop a hernia, and that mesh also gives more strength to the abdominal wall. So this is the gross physiology behind the treatment of hernias, where as I told you, the mesh is placed. Now, before, people used to do it as a large cut open procedures where patients have severe pain, stay in the hospital for many days, etc., etc. But today, even a complex hernia or a recurrent hernia, recurrent is basically, a complex hernia first of all is basically a large hernia, or a recurrent hernia is already if you've been operated for a hernia and you've got a recurrence there. Now, even those type of hernias today can be treated by minimal invasive surgery methods or keyhole methods, where you can get into the hospital and get out of the hospital within 24 hours, and it's very, very simple and a painless procedure, and the recovery is super fast and super smooth. I've had patients who are at the age of 85 or 90 years old come to me with large hernias where we've operated as a keyhole method, and they've gone back the next day, spent the time with the family and the grandchildren. Thank you.